Axilla or armpit in layman's language. Axilla is a site for a lot of very important structures, nerves, vessels, and a group of lymph nodes which are very clinically relevant. So you must know about it. Just now you have seen the dissection. Let's go for the theory part of it. Done? Yeah, armpit or axilla is a pyramidal shaped space which is located between the chest wall and the humerus. It's between the chest wall and the humerus. Okay, it's a pyramidal space which is directed upwards and medially toward the root of the neck. The apex is toward the root of the neck and the base is directed downwards towards the skin of the armpit. It's a four-sided pyramid: anterior wall, posterior wall, medial wall, and a lateral wall. And one more thing you must remember here is that the apex, when you are talking about an apex, it's always come to the mind. The picture coming to your mind will be a closed and pointed one. Both are wrong. It is not a closed one. It's not. Neither is a pointed one. It's a channel actually. It's a triangular channel which convey the structures from the side of your neck to the armpit. Apex is truncated area. That means not a pointed one. And it is not a closed area. It is a channel which allows the structures from the side of your neck to come into the armpit. Okay? The flow is formed by the skin, superficial fascia, the deep fascia called as axillary fascia. So, how did you read the axilla in dissection? First, you have seen the pectoralis major. Side by side, you have seen a small portion of the deltoid. Then you reflected the pectoralis major. Here they have completely took out the pectoralis major and they are below the clavicle. You are seeing here, this is the clavicle, so the clavicular origin of the pectoralis major with what they have completely taken out. They have retained the deltoid. Below the, deeper to the clavicular head of the pectoralis major, we have a fascia here. Do you remember the name? That is the clavipectoral fascia. Clavipectoral fascia. Four things are piercing the clavipectoral fascia. Incidentally, I'm just asking you. They are the cephalic vein. This is the cephalic vein. Going deeper, pierce the clavipectoral fascia and going deeper, making a 90-degree bend to enter into the axillary vein. And one artery is coming out of it. Can you see an artery here? That is the thoracoacromial branch of the axillary artery. From the second part of the axillary artery, this branch comes. That is the thoracoacromial artery. Can you see a nerve here? Blue is vein, red is artery, and the yellow one is nerve. Always remember when you're drawing the diagrams in histology, gross anatomy record, always use brown for the muscle, blue for the vein, red for the artery, yellow for the nerve, green for the tendons, ligament, and fascia. So this yellow thing is the nerve, which the lateral pectoral nerve. Lateral pectoral nerve. Apart from this, the lymphatics from the chest wall, a part of the breast, also will be going deeper through the clavipectoral fascia to go up into the deep cervical group of lymph nodes. So these are structures pierced in the clavipectoral fascia. Below the clavipectoral fascia, you can see the clavipectoral fascia is splitting to enclose this muscle. Who is this muscle? This is the pectoralis minor. At the lower border of the pectoralis minor, the two layers of the clavipectoral fascia fuses with each other to form a single layer, what I am touching right now. That is called as the suspensory ligament of the axilla. Suspensory ligament of the axilla. This suspensory ligament of the axilla is the one which is responsible for the dome shape of the armpit. That means it pulls the axillary fascia upward. It pulls the summit of the arched axillary fascia upward to maintain the concavity. Done? So we are almost reached the axilla now. You can see the structures within the axilla partly here. You can see the red one is the axillary artery, the blue one is the axillary vein. So we are entering into the room by cutting open the anterior wall of it. Done? So here you can see this is the pectoralis minor muscle. Okay. So what all thing makes the anterior wall? Pectoralis major, pectoralis minor, clavipectoral fascia, and a small muscle over here called this, what I'm touching right now, this running horizontally, this portion, the deeper one, is called as the subclavius. Okay, after exposing the pectoralis major, reflecting the pectoralis major, you are seeing the pectoralis minor. Now let's talk about the axilla a bit detail now. It's a four-sided pyramid whose apex is connected to the neck. This channel which connecting the neck to the axilla is the nothing but the cervicoaxillary canal, otherwise called apex of the axilla. The base is directed downwards and laterally, which is made by the skin fascia. An anterior wall, posterior wall, medial wall, and a lateral wall. Yeah, this is the way it will be. So here you can see the channel, the gap is going behind the clavicle. This sinusly curved bone is called as the clavicle. This is the first rib. Okay, this is the acromion process of the scapula. So this gap is going behind the clavicle but outer to the first rib. So this area is the apex. This is apex means this is the base. So this yellow thing what you are seeing is the base formed by skin and fascia. This, what is this lavender color is the medial wall. Okay, this blue color is the lateral wall. What is this is the anterior wall, the behind is the posterior wall. The green colored is the apex. Let's talk about the apex now. Apex is actually a channel behind the clavicle but outer to the first rib and in front of the upper border of the scapula. It's a triangular space bounded anteriorly by the clavicle, medially by the first rib, posteriorly by the upper border of the scapula. So this is the apex. So that allow the cords of the brachial plexus to enter from the side of the neck to the axilla. It allows the subclavian artery to continuous as the axillary artery. It allows the axillary vein to go up and continuous as the subclavian vein. It allows the okay. So what is the base of the, this is that they are chopped, they have chopped the arm completely at the axilla. So this is the base of the axilla formed by skin, superficial fascia, the deep fascia, superficial fascia and deep fascia. Superficial fascia has got a lot of fat. The deep fascia is called as axillary fascia. In this fascia, you can see few group of lymph nodes. They are called the central group of axillary lymph nodes. The lymph nodes in the axilla is divided into 4 groups: lateral group, medial lateral group, anterior group, posterior group, central group, and apical group. Okay. Anterior, posterior, lateral, central, and the apical group of lymph nodes. This central group of lymph nodes are located in among the fat on the floor of the axilla or base of the axilla. Here you can see there is a nerve running over here. That nerve is called as the intercostobrachial nerve. Have you heard of this nerve term before? Intercostobrachial nerve. Intercostobrachial nerve is the lateral cutaneous branch of the second intercostal nerve, which supplies the skin of the floor of the axilla and the medial side of the upper part of the arm. It supplies floor of the axilla, skin of the pain, touch temperature from the floor of the skin of the axilla and also from the upper part of the medial aspect of the arm. Okay. With its a flow is like a dome shaped concavity. When you are abducting your arm up to 90 degree, the armpit take up a concavity, isn't it? So between this concavity is located between the anterior and posterior axillary fold. The anterior axillary fold is made by the lower border of the pectoralis major, and the posterior axillary fold is made by latissimus dorsi and teres major muscles together. Laterally by the latissimus dorsi, medially by the teres major muscle. Anterior wall. We just saw what is the anterior wall. It is made by the pectoralis major, clavipectoral fascia and subclavius muscle, pectoralis minor, and the a part of the suspensory ligament of the axilla. This is ligament of the axilla. So from to here, everything and the pectoralis major. If you go superficially from skin onwards, we can just tell skin, superficial fascia, pectoral fascia, pectoralis major, subclavius, then the clavipectoral fascia, pectoralis minor, suspensory ligament of the axilla. Posterior wall, you can see 3 muscles here. From medial to lateral, if you clean up the axilla completely, you can see 3 muscles are running toward the humerus. Medial to lateral, this muscle is the subscapularis. This muscle is the subscapularis. Then you are seeing 2 muscles here. The medial one is called teres major and the lateral one is the latissimus dorsi. Latissimus dorsi share a 3 relation with the teres major. First, it lies behind the teres major and it winds around the lateral border of the teres major to come and lie on the ventral aspect of the teres major. First, it will be behind or posterior to teres major, then it winds around the lateral border to come and lie in front of the teres major. So these 3 muscles make the posterior wall of the axilla or bed for the structures in the axilla. Medial wall of the axilla. Medial wall of the axilla is, this is the medial, nothing but the chest wall. This is the coast upper four ribs and the intercostal muscles between them. Over the intercostal muscles, we have the serratus anterior muscle and the fascia covering it. Over the serratus anterior muscle, you have seen the long thoracic nerve. All these make the medial wall. So we told the first statement was that it's a space between the lateral chest wall and the arm. So this is the lateral chest wall formed by the upper four ribs and the intercostal muscles between them, serratus anterior and the long thoracic nerve, which runs vertically downwards along the serratus anterior muscle. Lateral wall. Lateral wall is the narrowest of all. Here the anterior and posterior walls are converging towards the lateral wall. So it became so narrow. It is the nothing but the bicipital groove of the humerus. The upper part of the humerus, the upper end of the humerus, you have studied that there is a groove through which the tendons of the biceps passes, long head of the biceps pass. It is called the bicipital groove or intertubercular sulcus. That is the area where the lateral wall is made of. On the lateral lip of the bicipital groove, the insertion of the pectoralis major happens, and the medial lip insertion of the teres major along the floor, the latissimus dorsi is inserted. So all these are converging to a smaller, comparatively some smaller area. So naturally, the lateral wall is narrower. Can you see here? The one we are seeing, this one is the biceps brachii. Underneath the biceps brachii, can you see another muscle here, what I am touching right now? That is the coracobrachialis. Can you see a nerve entering into the coracobrachialis here? That is the easiest way to identify this muscle. A nerve is piercing that muscle. The nerve piercing is the musculocutaneous nerve. The muscle is the coracobrachialis. So what are the contents of the axilla? We have a lot of vessels and nerves here, making a lot of confusing chunk. Nothing confusing, you're just new to it. So you look like a bit confusing chunk, nothing of that sort. We'll make it out, don't worry. So here we are seeing the cords of the brachial plexus and in their branches. Axillary artery and its branches, axillary vein and its terminal tributaries, axillary group of lymph nodes and a lot of fat and connective tissue. Boundaries of the axilla. It is a pyramidal shaped space located between the lateral thoracic wall and the upper part of the arm. Okay, in layman's language, armpit. Actually, the hairy area, the armpit, makes the floor of the axilla. Okay, it has got 4 walls: anterior wall, posterior wall, medial wall, and lateral wall. An apex and a base. Base is nothing but the skin and fascia. Okay, coming to the anterior wall, we are entering into the room through breaking through the anterior wall of the room. So what all it makes? Skin. Deeper to skin, you have the superficial fascia. One more forceps. Skin. Then the superficial fascia containing the supraclavicular platysma, supraclavicular nerves. Okay, this is superficial fascia. Yellow one is the superficial fascia containing a lot of fat. Okay, here we have the supraclavicular nerve descending down. And there's a subcutaneous muscle over here, what is called as the platysma. This is the platysma muscle. What I'm holding with the right hand is the platysma. Okay. Then underneath the platysma, we have this is the pectoral fascia or the deep fascia of the pectoral region. We cleared it. Now what is coming into your view is the pectoralis major. We are reflecting the pectoralis major by cutting the clavicular head as well as the sternocostal head toward the insertion. Okay. When you are doing so, you can see the clavipectoral fascia, which is located underneath the clavicular head of the pectoralis major. So this is the clavipectoral fascia, which is pierced by 4 things. This is the cephalic vein. Okay, this is the cephalic vein. Here you can see one artery is going upward. This is the thoracoacromial artery. Zoom it whenever needed. Okay, thoracoacromial artery. Okay, a nerve which got detached. This was supplying the pectoralis major as well as the minor. This is what I'm holding with the left hand. This is the lateral pectoral nerve. Lateral pectoral nerve. Okay, so cephalic vein, lateral pectoral nerve, and the thoracoacromial artery. This one, this branch, thoracoacromial artery, pierce the clavipectoral fascia and the lymphatics from the somewhat part of the breast, and the one which is coming from the lymphatics from the infraclavicular triangle will pierce the clavipectoral fascia. So that clavipectoral fascia make the anterior wall, a part of the anterior wall of the axilla. Okay, the upper portion, the clavipectoral fascia, encloses the muscle called as the subclavius. So from above downward, subclavius, clavipectoral fascia, and in the lower portion, as it reaches the pectoralis minor, it splits to enclose the pectoralis minor again. So pectoralis minor. At the lower border of the pectoralis minor, it forms the suspensory ligament of the axilla. So all these make the anterior wall of the axilla. Okay, skin, superficial fascia, deeper the superficial fascia, you have the deep fascia. Then the subclavius, clavipectoral fascia, pectoralis minor, and suspensory ligament of the axilla make the anterior wall. Now let's go for the posterior wall. Can you see muscle here? This one. This is the major. This is the latissimus dorsi. Subscapularis, teres major, and latissimus dorsi make the floor. Posterior wall. Make the posterior wall of the axilla. This is the medial wall. I told you it's a space between the lateral chest wall as well as the arm. So this is the medial wall of the axilla, which is formed by the upper 4 ribs and the intercostal muscles between them, and a thin but a wider sheet of muscle here. What I'm lifting right now, this is called as the serratus anterior. Serratus anterior. Okay, over the serratus anterior, you have the nerve supply for the serratus anterior. This is called as the long thoracic nerve or nerve of Bell. This is the long thoracic nerve or nerve of Bell. Done. So this is the medial wall. The lateral wall is the narrowest of all, which is where the anterior wall, pectoralis major and the latissimus dorsi is converging. Latissimus pectoralis major, latissimus dorsi, and the teres major is converging toward the intertubercular sulcus or bicipital groove. That area makes the lateral wall of the axilla. So upper end of the humerus, where the pectoralis major, teres major, and the latissimus dorsi inserting. That makes the lateral wall, this area, the lateral wall of the axilla. This is medial, this is lateral, naturally. Let's go for the apex. If I put my forceps underneath the clavicle, behind the clavicle, okay, that area, that is the apex of the axilla. That means it's not a closed space. When we talk about a pyramid, it may assume that it's going to be a closed one or it is a pointed one. Neither it is a pointed area nor it is a closed one. It's a channel. It's a channel allowing the structures from the side of the neck. This area is called as the posterior triangle of the neck. From here, the course of the brachial plexus will come into the axilla through this channel. So if I put the forceps here, this channel is bounded anteriorly by the clavicle, medially by the outer border of the first rib, posteriorly by the upper border of the scapula. So this channel is called as the apex of the axilla, otherwise called cervico-axillary canal. Cervico-axillary canal. Okay. So what all things are coming through the cervico-axillary canal? You can see here, these are the chords of the brachial plexus. Chord of the brachial plexus, axillary artery, and the axillary vein continues as the subclavian vein at the outer border of the first rib. Okay, clear? And the lymphatic trunk. Coming to the flow, this is the hairy fascia. In the axillary fascia, you can see few structures here. This is the axillary group of lymph nodes. Axillary group of lymph nodes are divided into four groups again. The one which is located on the floor is called central group. Is called as the central group, which is located in among the fat. And among this fat and along this lymph nodes, there lies one nerve running horizontally. This nerve is called as the intercostobrachial nerve. Intercostobrachial nerve. We simply run horizontally and reaches the area among these lymph nodes and enters into the medial aspect of the arm, supplying the floor of the axilla as well as the medial aspect of the arm. Okay? So, in the case of carcinoma of the breast, when these lymph nodes are getting enlarged, the nerve get compressed, irritated. Then the patient may feel pain in the floor of the axilla as well as on the medial side of the arm due to the irritation of the intercostobrachial nerve. Okay, cut it off. So the